Thank you. My name is Diane Mcclure. I'm a registered nurse. I've been a registered nurse for 32 years. I work here in Sacramento, in South Sacramento, and I live in Sacramento. I'm also a member of the California Nurses Association Board of Directors. I am super excited to see that Katie Valenzuela added this to the agenda as far as AB 1400 and HR 1976. That would be CalCare as well as the National Bill Medicare for All. I would very much like to see this resolution passed. I know that obviously some other major cities, I believe we're up to about 10 in California that have adopted this resolution, including LA, Oakland, and San Francisco. And I do believe that we need to be right up there with them and to really work hard on getting this passed. I've personally worked very hard. As a registered nurse, going through this pandemic, I've seen all the more need for people to be able to have Medicare for all. I believe that healthcare is a human right. I personally have seen people lose their jobs and thus lose their insurance. And some people just work just for insurance, and it's not right. Healthcare is a human right. People need to have healthcare and not have to worry about trying to scrape just to have that healthcare. I personally have seen patients even turn down for surgeries. I work in a surgical area. I've seen them turn down for surgeries, even when the doctor has deemed it necessary to have this surgery. And then they have ended up not getting the surgery, and then that just perpetuates not being able to go back to work because they can't work until they've healed. So I absolutely urge this City Council to please pass this. It's super important, and the nurses will absolutely be behind you.
Thank you for your comments. Next speaker is Kathleen Williams.
Mute. Yeah, my name is Kathleen Williams. I'm also calling in to support the resolution for AB 1400 and the national one as well. I note that CalCare has counted 3.2 million Californians without insurance. It is a desperate situation. I just recently had cataract surgery. It was $20,000 an eye, but because I'm a member of Medicare, I didn't have to pay. And I think that should be available to everyone. And there's definitely a coverage gap where the very poor may qualify for Medicaid, whereas the middle income people do not. So I really think, we've spoken of Sacramento leading the charge. I think we should join the other cities in California, including San Francisco, to resolve in favor of this and fight like hell for CalCare. Thank you.
Thank you for your comments. Next speaker is Anna Jenkins.
Hello, can you hear me?
We can. Please proceed.
Oh, my name is Anna Jenkins. I am also an RN, and I was born and raised in Sacramento. I work at a hospital in the city that provides care to uninsured Medicare and Medi-Cal patients. I see the negative impacts our broken healthcare system has on my patients, their family, and our community each and every time I work. We have patients that come in emergently who were too scared to seek care before it became urgent because they do not have access to primary care. We have patients that during their emergency health event are more concerned about their bill than they are their recovery. We have patients who cannot be properly and timely discharged to skilled nursing facilities due to the facilities not accepting their form of insurance or lack thereof insurance. We have patients who tell us heartbreaking stories about not being able to pay for their prescriptions or who ration their medications. The stress and anxiety of not having insurance or having inadequate coverage impacts our patients' mental health, which is another very important layer to this problem, as many do not have access to therapeutic social services they need and deserve. As a society and a state, we can fix these problems. We can ensure that all people have access to health care by passing and supporting CalCare AB 1400 and HR 1976 and the Medicare for All Act of 2021. I'm here asking the City Council to follow other cities across our state and support these very important bills and to support the people of our community. Thank you.
Thank you for your comments. Next speaker is Robert Copeland.
Hi, my name is Robert Copeland. I belong to Healthcare for All, Sacramento Valley Chapter and DSA Sacramento. I concur with what the other speaker said because our healthcare system is broken. Because I've gone to the pharmacy and couldn't pick up medication that the doctor prescribed. We're paying more for healthcare and get less than other nations that have a single payer system like Medicare for All. Thank you.
Thank you for your comments. Next speaker is Philip Kim.
Hi, council members and mayor. My name is Philip Kim. I'm a community organizer with the California Nurses Association, also a proud Sacramento resident in Southland Park, District 4. First off, thank you to the mayor for writing a letter to Representative Doris Matsui, urging her to co-sponsor the Medicare for All bill. Really appreciate your doing that. And thank you to Councilmember Vang for speaking at our CalCare car rally that we had back in April. And finally, I want to thank Councilmember Valenzuela for adding the CalCare and Medicare for All City Council resolution to the agenda, which is the main reason why I'm calling, item 14. Over 50 cities across the country have taken a stand for healthcare justice by passing resolutions in support of Medicare for All. And at least 10 cities in California have passed resolutions this year in support of AB 1400, the California Guaranteed Healthcare for All Act, also known as CalCare. AB 1400 at the state level and the Medicare for All bill, HR 1976, on the federal level would create single-payer healthcare systems and guarantee comprehensive, high-quality healthcare for all residents in California and the United States, respectively. They would replace the current profit-driven patchwork that is actively harming and bankrupting thousands of Sacramentans every year, and replace that with a single-payer guaranteed healthcare system focused on patient care, not profit. Unfortunately, because of the greed of the insurance companies, big pharma, and corporate hospital chains, too many Sacramentans are not able to get the care that they need due to high cost. And now that a majority of insurance companies are no longer waiving the full cost of COVID treatment, it's all the more urgent that we fix our broken healthcare system. So I urge you all to pass the CalCare and Medicare for All resolution. Our city has a really important role to play in getting our legislators on board. These bills are supported by the California Nurses Association, the Sacramento Central Labor Council, the Democratic Party of Sacramento County. Thank you all for your consideration. Have a great day.
Thank you for your comments. Jennifer Muir is the final speaker on the consent calendar.
Hello. Thank you. Thank you so much, council members Valenzuela and Vang and Mr. Mayor, for supporting our endeavor to get coverage for all Sacramentans. My name is Jennifer Muir. I live in Central Oak Park. Jay Chenier is my council member, and I am asking him to please support AB 1400 CalCare or HR 1976 Medicare for All that would guarantee high quality comprehensive health care for all Californians, putting an end to the crippling medical debt plaguing our society today. In California, it is mandatory for us all to have medical insurance. However, it is not mandatory for insurance companies to cover all of our bills. And we are increasingly seeing more and more insurance companies get around coverage for Californians. Personally, I was dropped from Covered California when my income dropped below the minimum level needed for subsidized insurance through Covered California. And I can't afford the $1,000 a month it would take for a private insurance for myself right now. So I'm on Medi-Cal. And because of my age, Medi-Cal is telling me, I'm turning 55, that they will tax my estate when I die for what I use under Medi-Cal. This is outrageous. It really does infuriate me. I would like to get out of this medical quagmire and have my medical insurance covered. Let's get CalCare and Medicare for All passed so Californians don't have to live with this horrible idea of debt over their heads all the time. Medical debt is the #1 reason we become bankrupt here in California and in Sacramento. Thank you so much.
Thank you for your comments. I have no more speakers, Mr. Mayor.
Okay, well, thank you. Thank you, Councilmember Valenzuela. So this is on the log, so to speak, and whether the will of the council is to bring back full vote. I'm good with that. Let's do it. Let's get on record. I've supported single payer all my career because I believe that the current system does not adequately cover people, especially for preventative care, especially in the mental health area, especially in areas where the need is so great. And so I'm fine with it. I'm not quite sure now exactly what the procedure is, Madam Clerk. We don't need a vote, do we, on this? It's just whether members want to comment.
I thought we would bring it back as a resolution for a vote, right? That's the request because it's on a pending log. Is that correct,
It's on the pending log, but
That's right.
you got to go from the pending log.
So we have to approve it, and then a resolution will come to council for a vote.
Okay, so that's the way that'll work. Okay, thank you.
Correct. The agenda item today is just moving it from the city clerk's log of requests to the
That's
follow-up
right.
log for staff to work on.
That's right. Okay. I do want to talk about another item on the log